Good afternoon. Welcome to today's webinar. And I just wanted to mention that this is our third in our rural webinar series. And we will send out the recording for our webinar today at the conclusion of our session. But I'm very, very, very thankful and looking forward to hearing from Aubrey McEnroe, who is a doctoral candidate in our counseling psychology program here at the University of Iowa. And the name of her presentation today is Bridging Distances, Cultivating Mental Health Support for Rural Advanced Learners. And one thing that's just kind of exciting that wasn't in the bio that Aubrey just recently found out where her internship is going to be. And congratulations to Aubrey for landing a position at the Des Moines University's Behavioral Health Clinic. And I think that starts in the fall, right? Or the summer already.
Yep, July 27th.
Oh, wow. That's a great day. It's my birthday. And then if you looked in Aubrey's bio, she happened to say that, she's remained closely connected to her roots. And so I'm just really glad that she kind of has that leading mantra or that leading commitment because it brought her to us today. And so without further ado, I'm going to pass it over to Aubrey and she will share some information with us and then we'll have time for questions at the end.
Sounds great. Well, thank you so much for the warm welcome. Today, what we are going to be discussing primarily is rural mental health for rural communities throughout our state and what that looks like in the United States as well, and how that presents for our advanced learners in our rural communities. And then a big portion of this presentation today is I'm hoping to kind of plant some seeds of ideas of bridging those distances for those students to hopefully access the appropriate mental health resources or services that are accessible to them in their area. And so, if you see me looking down a little bit, I do have some notes for my presentation. Hopefully, this will let me. There we go. But first, just a little bit about me. It's in the bio, but I always like to introduce myself before getting started. As mentioned, my name is Aubrey McEnroe. I'm from Algona, Iowa, which is north central Iowa, rural agricultural community, where I grew up on my family's third generation row crop farm, where we primarily grow and harvest corn and soybeans. And I completed my Bachelor's of Science in Psychology from the University of Iowa and have been fortunate to continue my graduate studies here, pursuing a PhD in counseling psychology with primarily research and clinical interest in rural psychology and specifically an understanding more of the mental health outcomes for women in agriculture. And these two pictures are of my family's farm and me on the farm. So I always like to bring a little bit of Iowa into my presentations. Okay, and for the agenda today, I know we don't have as many people here, but I am going to try this activity for those of you who are here. And if this goes well, great. And if it not, it's okay. For those of you who are watching this recording, I just ask that you think about this activity and the question that I will present. But I like to start with an activity to get our minds going and also to create a community through Zoom as many times. That's the difference between in-person versus Zoom is that sometimes that lack of community. So I always like to create that in my presentations. But moving forward, I'm going to start broadly talking about rural mental health, what that looks like right now for our state and throughout the United States, barriers for rural mental health, and then start going more in depth about the mental health of our children here in Iowa, specifically rural communities, and then the mental health of advanced learners, how they might be impacted by those also barriers. And then the key aspect of today's presentation is bridging those distances. And then at the end, I always like to offer mental health resources that are offered throughout our state that might be accessible for your students and children within your communities. Okay. So if you have a smart device, I would just ask that you scan this QR code and we're going to create a word cloud. And this is for the individuals who are here today. If you're just watching this recording, don't worry about scanning the QR code, but I would like you just to think and reflect about this question of what mental health concerns you have observed in your rural advanced learners. That might be in individuals you've worked with directly or individuals you've observed within your own school system. But I really want to get our minds going about what mental health concerns, whether that be symptoms, signs of mental health concerns that you've noticed, specifically in these learners. And as we do that, I'm just going to take a couple minutes and we're going to create a word cloud together, and you can um, submit multiple answers to this question if you have multiple observations that you've made. And the word cloud probably won't get too big since we don't have as many people here today, which is okay. But the more responses, the larger the word cloud gets. So I like to create this word cloud as a way to kind of start the conversation around what symptomology, signs of mental health concerns that you're seeing, and how this is connecting to our conversation today. First one I'm seeing, yes, peer pressure, under challenged. That can definitely be very common in rural communities. We'll talk about that a little bit later today as well. Other ones I'm thinking of as well as isolation can be pretty common for these students. The multiple roles that they're playing. I'll also talk about that as well. We'll just take a few more seconds on this and then we can move forward. And if you're just joining us, feel free to participate in this activity if you're interested. We are starting with this activity. You can scan this QR code if you have a smart device, and we're creating a word cloud answering this question of what mental health concerns you've observed in your rural advanced learners or individuals you've observed within your school system. Stress of being different, that's a big one as well. Fear of leaving home, specifically for high school students also who are getting ready for college, getting out of that. Sometimes I like to say the rural bubble can be really intimidating and also just really scary as well. Perfectionism. Lack of professional support, so that the lack of resources for these students. I'm going to talk about this a little bit more too, but imposter syndrome, specifically for urban cities compared to rural communities. There has been research done that I'm going to talk a little bit about that. Anxiety and depression symptoms, 100%. I still have a couple people typing, so we're gonna stick with this just a couple more, and then we'll move on. These are really wonderful. Specifically, also, no one's like them. That can, again, that isolation piece. Many times these students are taking advanced classes, either with individuals who are older than them, or maybe there's only a select few of them in these classes. And so it can definitely create, again, this isolation. Great. Okay. Thank you for participating in this. And for those who are going to be watching this recording, maybe you are also noticing this as well with students that you've worked with or what you've observed in your own school system as well. And again, I wanted to create this activity because I think this creates a good sense of community amongst our various school workers here today and those of us who are going to be watching, that this is pretty common throughout rural communities and for our communities in our own state. And so I think this sheds light on really the mental health concerns for our students in rural communities. Okay, I'm going to keep us moving forward here. As I mentioned, we're going to start with rural mental health, starting broadly and then moving more in depth about what rural mental health looks like for our students and children in these rural communities. specifically for rural mental health, I, as I mentioned, like to start broadly. And what we know throughout the United States is that there's a significant lack of mental health resources, providers, and even facilities, even close to rural communities and within our own state. I don't typically offer a ton of statistics in my presentations, but the ones that I do include, and for the ones that we include for today, I chose specifically for this conversation today because to me these numbers are really starking and paint a picture of how large this concern is for our country and for our state. And so the first one I like to point out is 160 million Americans across the United States are living in mental health shortages. And what that can look like specifically for our state here in Iowa is we have 99 counties, and 89 out of those 99 counties are considered in a mental health shortage area due to the limited providers and resources available, which is pretty starking again, as I mentioned, at least for me, and is heartbreaking. And what this number contributes to is there's service access difficulties compared to rural versus urban communities. And so what's really common in rural communities is the lack of internet access, but more specifically, limited broadband access. And so what that means is individuals may have internet, but might not have the broadband or what I think of the juice of the internet to be able to connect via telehealth with providers. And so that limits the option of telehealth for individuals in rural communities. And that 26 million, to put that into perspective, that's one in every 13 American in rural communities that don't have enough broadband access in areas or live in no broadband access areas. And another potential barrier is also many individuals in rural communities are living with multiple individuals, such as multiple family members, many siblings in the house, which can lead to privacy issues when it comes to telehealth as well. And what's also interesting between urban cities and rural communities is the exposure to stressors. And I'll get into this a little bit more too in the next slide. But primarily, as we know, at least here in the state of Iowa, rural communities, a primary source of income is agriculture. And agriculture itself has a ton of stressors. And many of us know individuals who are involved in agriculture in some way, shape, or form, as well as just being community members ourselves. We hold multiple roles, and all of that increases stress or exposure to stress compared to urban cities. And additional barriers to care, first and foremost, is mental health literacy. And I define this as um, really knowing and understanding the knowledge or having the knowledge of the signs and symptoms of mental health concerns and knowing where to access mental health resources, what resources are available. And what we know is within the last 5 to 10 years, there's been an increase in awareness of the mental health concerns in our rural communities. However, the mental health literacy, so that knowledge piece of what signs and symptoms to look out for, what resources are accessible to you, is not matching that awareness. So awareness might be up a little bit more, and the mental health literacy is just a little bit behind. And so that's an additional barrier is just a lack of knowledge, stigma, affordability and insurance difficulties, transportation barriers, specifically if you're trying to locate someone in person for mental health services, family and partner support. And then again, as I mentioned, these increased stressors, and this could be intersecting roles. So as many of you here are who have worked in schools or are working in schools today, a big component is this intersecting role piece where, at least I know from my own experience growing up in a rural community, many of the teachers and school workers had many roles with just in the school. Many of them were my coaches. Others were also volunteering in the community, maybe being involved in their religious community as well as having a home life, being a mother, being a father, um, being a daughter or father as well in the rural community. And so all of these intersecting roles add additional stressors that and additional barriers to care that might not otherwise be found in larger cities, such as our urban counterparts. And to just kind of put this a little bit more into perspective, these external stressors, as I mentioned earlier with agriculture, I'm going to use that as an example, can lead to economic constraints for rural communities and those economic constraints as well as environmental constraints. So in northwestern Iowa, we had a lot of flooding occurring, especially up in the Okoboji area and this in Storm Lake, that area just a few years ago. And that creates a lot of external stressors for one's community. And then on top of that, you have internal stressors, which are interpersonal conflicts, so conflicts within the home and at home, what that could look like conflicts with your partner, with in between siblings, with parents, etc. And that can lead to increased experiences of isolation, specifically in rural communities. And then what the research has shown is overall is increased anxiety, depression symptoms, increased substance use in our rural communities, as well as increased suicidality rates. Okay, and so what does this mean or what does this look like for rural children? And again, I have quite a few statistics up here. Again, I think this paints a picture of this increasing concern for our rural children. And first and foremost, 24% of students are considered rural. So if you think back to that big statistic of 180 million Americans are in a mental health shortage, I would consider 24% of those students are part of that. And that means half of those students are also not receiving adequate services for their mental health needs. And what we do know is that children between the ages of 2 and 8 are most likely to acquire a psychological or behavioral disorder compared to urban kiddos. And so um, that can look like ADHD, for example. And as we continue going more in depth here, these statistics are basically showing that from the year of 2003 to 2020, that there has been a significant increase in anxiety and depression related symptoms, where primarily anxiety and depression symptoms have doubled since 2003, primarily till 2019. And recent research that I've been reading has also included that these rates they're expecting have probably almost doubled again or tripled from 2003 since COVID. Those numbers are not out yet. I was scouring all of my resources trying to find more statistics, but this is what I could find for right now. And there is ongoing research about the mental health concerns specifically for anxiety and depression for our rural children. And another starking statistic that I found really heartbreaking for me was also the suicide rates have really increased for individuals aged 10 to 24, and right now is considered the second leading cause of death for that age group. And potential causes, number one is low socioeconomic status. And so we classify that as individuals who um, are kiddos who are potentially living in a household that is barely making ends meet, maybe living paycheck to paycheck, or not making ends meet, don't have access to health insurance, etc. Second is perinatal concerns, and third would be exposure to early onset substance use in early childhood, and that would be alcohol, illicit drug use, etc. And then, as we know, complications, as I've mentioned earlier, and what we've talked about in that word cloud is really there's just a lack of resources for rural communities and even more so for mental health providers that are trained to work with children. And again, just lack of resources overall for these children and students. And so what this can look like for advanced learners is many of these advanced learners are experiencing symptoms of anxiety and depression related symptoms. They have increases in stress. Something that I also like to point out for advanced learners in rural communities are those intersecting roles. I mentioned that and kind of broadly in the beginning of our conversation today, but with advanced learners, they are many times participating in multiple extracurricular activities. In rural communities, it's common for students to be playing all four sports, participating in school plays, school choir, etc. And that even increases as they are trying to navigate college applications and their future as they get into high school. And when they get into high school, they might also have their first job or first couple jobs on top of that, and on top of taking advanced coursework and navigating that coursework many times with a small group of individuals and they might be taking those classes with older students or just by themselves. And so they might just be physically isolated from their peers as well. And so all of that creates increased isolation and increased stress that can lead to increased anxiety and depression related symptoms. And just things that to take note for your advanced learners of the various roles and intersecting identities that they are holding when they're coming to school and also when they're going home. What I didn't mention was also their home lives. So they are also navigating their different roles in their home life as well. And so all of that contributes to their mental health and their mental health concerns. And some of these barriers to care are similar to what I mentioned previously, but what is also really important to note here for rural children and for students, first and foremost, is transportation, especially if they do not have a license yet or haven't yet or are not able to get their license. Second would be access to a private and safe environment for telehealth if telehealth services are available to those communities. These students, again, at home, they might not have the technology such as a computer or smartphone. If they do, they might not have enough broadband access to be able to access telehealth services. And if they're sharing a room with multiple siblings or other family members, telehealth really might not be the safest option for them, which is where schools come in as really the first option for students to be able to potentially access mental health services from a private space. And another would be supportive family members. And lastly, which is really important to take note of, is these students and these children are less likely to ask for help just due to the lack of knowledge of the signs and symptoms. Many children don't know what emotions are yet, or they're exploring their emotions for the very first time, might not have the vocabulary to express what they're feeling yet, and may just quite frankly not know that they need to be asking for help. And so all of that can also be considered a barrier to care. And so bridging distances and what that can look like is hopefully creating a bridge for these students to be able to access appropriate mental health services. And I always like to put a caveat in my presentation at this point in time by saying it is not any teacher or school affiliated worker's job to go and become a therapist and take additional mental health classes to provide therapy to students. Primarily, what I'm hoping today is just plant different ideas that can bridge, again, these students to appropriate mental health services to potentially a school psychologist or school counselor if available. And what I'm talking about now moving forward is how to bridge that is through different school-based strategies. And the first one is a comprehensive school mental health system. And this is a model that is pretty heavily used throughout the United States. There are multiple models. So this is not just one gold standard model. There are multiple, but this is one that I have found to be most commonly utilized in research as well as throughout many schools. And so I wanted to introduce this today. And some of this information you may have heard, other information might be new to you. And so with this strategy or this model, and specifically with this pyramid, it's starting at the bottom and working our way up. And so what does this pyramid mean is if you start at the bottom, what a school can do to bridge students in getting appropriate services would be first and foremost, creating social emotional learning lessons or adding curriculum about emotions and expressing emotions potentially. And we call that tier one or the bottom of that pyramid. And the second is targeted interventions. And so as students are starting to learn and talk more about their emotions and their mental health concerns, is creating small groups for students to be able to check in with each other, work with each other in regards to navigating mental health concerns and what that can look like. And then third would be um, of getting these students the appropriate mental health services, so more individual services, whether that be with a school counselor, school psychologist, or community-based care, um, through the school, being able to connect them in that way. And so I think this is a great way to bridge services. Some schools are already doing this, some may not be yet. And is, I think, a unique way that rural communities can still create a community within their schools. And what this can look like in a more individualized level is for you yourself, I think it's important to understand the signs and symptoms of mental health concerns in children, not meaning that you need to again go and become a therapist unless you absolutely want to do that. But I think it's important just in general to understand what are the common signs that are showing up in your students and the signs that you all talked about in that word cloud earlier apply to this as well. So those common signs that you might notice in your students are low mood, potentially falling asleep in class, their school performance is declining, feelings of hopelessness and feeling isolated from their peers, and other strategies to I've noticed that other teachers have integrated in schools here in Eastern Iowa that I volunteered in are integrating coping skills or learning coping skills such as calm corners. So some teachers I've seen have really comfortable chairs or comfy pillows in a corner with fidget spinners or um, like stress balls and even drawings to draw out potentially their feelings. Part of social emotional learning lessons could be integrating journaling or drawing exercises for maybe the first time. I've observed teachers put feelings wheels on students' desks, taped or laminated on their desk, just to integrate the knowledge of and putting words to emotions for maybe the first time. And other ideas could also be morning meeting groups or end of the day check-ins. That could be 5 or 10 minutes, maybe just a couple minutes checking in with you, or having small groups of students just to check in with each other, or have partners checking in with each other, just simply asking how are you feeling today. And what that does is it does create that community amongst the students, but it also challenges that stigma surrounding mental health. And so with that, we're creating that conversation of mental health within curriculum as well as in the school. And then hopefully they'll then take those seeds and grow beyond their time in K through 12. And hopefully we'll continue that throughout the rest of their lives. And lastly is mental health resources in Iowa. Feel free to take a picture of this. This is not an exhaustive list. This list is primarily resources that I've found to be beneficial in my work so far. However, I know there's a plethora of other resources within the state. I tried to find different resources as well from different parts of Iowa and offered the URLs that you can explore those websites more yourself. But feel free to take a picture of this and you can integrate these resources with parents and students that you feel that might need these resources. But that's all I have for today. And I know we can use the rest of this time for any questions or comments. And I also have my email up here as well. I'll have that on the next slide. I just want to make sure everyone has enough time to take a picture of this slide. But also, if anyone has any questions that I don't feel comfortable talking about today, or even if you're watching this recording and you have questions, feel free to email me. But with all that being said, I'm going to open the floor to any questions or comments. Maybe the individuals who are here have witnessed or have integrated other mental health ideas in their classrooms that have been helpful. So feel free to share if that's been helpful for you. And if not, that's okay too.
Thank you very much, Aubrey. A lot of excellent information, and I know we have at least one question that appeared in the chat. And I know that's going to be asked, and I just really wanted to emphasize the first resource you have there because the Scanlon Center for School and Mental Health does a great newsletter that you can sign up for that gives you a lot of things that they're up to,
Mhm.
including some more webinars and those types of things. So I don't know if we'll open the floor to questions now.
Yeah.
Aubrey, I don't have much of a voice, so I don't know if you can reference my question. I asked a question in the chat
Hmm.
about was the 2 out of 8 students likely to develop ADHD and stuff like that.
Hmm.
But I didn't understand that statistic. Was that a comparison to urban? Are they more likely to develop those things? Or
Hmm.
I thought the wording was a little bit unclear.
Yeah, and I apologize for any confusion. That statistic was in general to for students to age 2 to 8,
Okay.
and that one was not specifically between rural and urban students
Okay.
when I was reading that article. So that was just in general. We know that our students, specifically ages 2 to 8, are most likely in between that age group are can potentially meet criteria for disorders such as ADHD.
Okay. So I'm in the northwest corner of Iowa, and I don't know if any of you can address this question, but
Mhm.
um, I often think that some of my students would love some of the enrichment, weekend things, activities. Have you ever thought about having a satellite out in this area, where you come and you set up for just a Saturday and do some of the classes that you offer in the Iowa City area?
That is not my expertise, so I will defer to Randy or Josh for that question.
And I'll be
I can
honest, I'm
chime in
not.
a little bit.
Yeah,
Oh, go ahead,
thank you.
Randy.
I
Oh,
was just going to say I don't know the answer to that, but I can definitely bring it up to our student programs team because that's who runs our weekend enrichment and that type of thing. But Josh, you,
yeah, and we have done that in the past. We've had satellite programs in Des Moines and a couple other places, and I think we're doing something recently in Omaha. It's a challenge for us as well to be able to offer that, several hours away from our home base here.
Right.
But if we can find partners that are able to sort of help us in the community, we're always willing to work with them and see what we can get set up. So if that's something that you think there's a need for, we can certainly investigate that and see what the options are, what would work best for you guys.
Well, I will do some exploring. I have several math Bs coming up at Northwestern College in this area with other math teachers, for example. That's my primary area of focus. And yeah, I'll just kind of, if I remember, I'll feel them out and ask about what their thoughts are. I just know I've looked at some of the writing programs and just uh, it looks like you've got great stuff going on, but it's
yeah,
just not a possibility for our kids at all. And yeah, there's really nothing in our area except for math bees
Yeah.
for
Yeah, and
gifted kids.
we do get that, and we've heard this more than once, and it's something that we talk about, and yeah, it's definitely needed. It's way too long to have to travel 3 or 4 hours in the car just to come
yeah,
to a day long program. So
yeah.
Right,
we do
right.
hear you.
And this overlaps exactly with Aubrey's point about transportation and geography issues for
Mhm.
sure. And so,
Hmm.
it'd be, I know that we've done stuff at AEAs too, but more like professional learning. But I don't see why we could at least explore that option too. Of a lot of the AEAs have facilities too. I think I haven't
Right.
been to all of them. So, but yeah, I definitely will follow up with you, Kim, because we have your email. We can talk more and see if there's, to Josh's point about trying to find a partner.
Okay.
Hmm.
Are there other questions?
just sort of one general question. It it certainly seems like the need for services and the services provided or the resources available are kind of moving in the opposite direction, right? The needs seem to be increasing, and the
Mhm.
funding and support and availability, especially in rural areas, seems to be decreasing. And so I'm just wondering if you can talk a little bit. And I know it may be, I don't want to veer into sort of political territory necessarily, but like why that might be, and are there ways um, for educators in the schools and for folks like Randy and I, like what do you see as the best ways to advocate um, for those rural populations and mental health in particular?
Yeah, great question. And to the first part of your question, that is what we are seeing specifically in our I'm just talking now for the state of Iowa. Funding for mental health resources and services has decreased the last, I would say, year or two. And um, I think advocating as much as you can with state legislator, I think that they need to hear from our schools and hear from us. I last spring I was speaking with state legislators about rural mental health, and at that point in time, there were very minimal bills being considered for mental health for our state, specifically um, for rural communities. And so I think what individuals can do in schools really is, as I mentioned, trying to find a community within our community. And so we might not everyone's interested in going to the state level of talking to state legislators, which is okay. But I think what can be helpful, even from individual perspective, is creating just like those support groups and starting in those classrooms of creating check-ins with your students and creating just a space for students to um, feel safe enough to say that they need resources. And second would be um, trying to equip schools with the technology needed for telehealth services because there are so many rural communities who don't have mental health providers, period, in their community. And so let alone a pediatric mental health provider. So I think many of the rural schools, even in my own community, are now just having like a separate office space for students to go and meet with a community mental health provider. And so I think that can be beneficial for schools to start bridging some of those that distance. But if interested on more of a system or systematic level is continuing to show our state representatives and legislature that it's needed. Showing these statistics, I also have there's like this picture of the state of Iowa with all 99 counties, and pretty much besides those 10 counties that are considered equipped with enough mental health providers, the rest of the state's in like dark blue. And so I think as a university, we can do more as well of pushing for mental health services needed throughout our state. And I think also just providing as a university through webinars like this, providing the resources that are accessible um, throughout the state for teachers or any administrators alike to have handy to be able to offer to parents and students as well. That's a long-winded answer, but I think it's hard for systemic change, but trying to make do with what we have by creating a community and trying to combat that stigma, I think is a great way to start in schools. And then as a larger university, we can push more as a system against that other system that is continually defunding mental health. So I hope that answered your question, but
Yeah, no, that was very helpful. Thank you.
And I think
I
it's great, Aubrey, just to have resources. A lot of people just aren't aware of all of these, and I don't,
Mhm.
not gonna call anybody out, but our webinar from last year, our speaker, Dr. Chandler, had talked about one of the big benefits of a rural and small town setting is the sense of community. And
Mhm.
so I think this kind of mirrors here that, not everyone has to go to Des Moines and do these things. And maybe, the power of one or maybe the power of a couple of like-minded peers of, what can we do and tapping, our social capital we do have in our community and the expertise we do have in our community that could help out, I think is can go a long way for sure.
I'd like to say something about teacher training, and I know you guys are involved in the um, gifted education, obviously, right? But I think that like one piece of the whole mental health, which starts in the schools, is to get our teachers trained on
Hmm.
gifted students,
Mhm.
about gifted students. And I think a lot of teachers do not understand them. And they're not equipped to meet, even begin to meet their academic needs, much
Yeah,
less their mental
yeah,
needs. And they don't see like how not being challenged can provide problems and things.
yeah.
So I think that's continuing to be a concern of mine is how can we advocate for teachers to get their um,
Hmm.
talented and gifted
Yeah.
license or just an endorsement in that regard.
Yeah, that's a great point, and we're really happy that we're able to. The last 2 years have a cohort that we have a scholarship for, and we're also starting conversations to work on, because not everybody, because the tuition's expensive here at the University of Iowa. So coming up with working with our Baker Teacher Leader Center on more of a series of modules that would be, much more accessible to a lot of people, and wouldn't lead to a degree or an endorsement per se, but it could hopefully lead to some really good information that teachers can use in their classroom, especially from a practical sense.
I love that idea because yeah, I think it's intimidating to think many of my coworkers
Yeah,
have their masters already, but
yeah,
then to think about
yeah,
going back for more, but
yeah,
something smaller,
yeah,
something that they can do fairly
yeah.
quickly would be helpful.
Well, that's what I'm hoping. I like our webinar series here. We started with zero, and then now we're at our third installment, which is small steps type of thing. And speaking of steps, I have a question for you, Aubrey. I just looking, for maybe a suggestion because, I just know that teachers have some of the biggest hearts in the world, and I taught for a long time. And do you have a suggestion for, your although your statistics are appalling, and and
Mhm.
how can what can teachers do to the best they can to detach a little bit to separate and compartmentalize some things and to make sure that this isn't weighing them down so much that it's affecting their own mental health. I don't
Yeah,
know if
that's a
I
great
verbalized the
question.
question, but I think it's an important thing of that
Yeah.
all the caring
Um,
professions deal with this, I think.
yeah, 100%. And this comes up in mental health profession in my own profession as well. And I will definitely say that trying to leave your work at work is really hard,
Yeah.
specifically when you're working with children of all ages and with mental health concerns. It's hard not to take that home and be worried about, oh, are they getting a meal tonight? Are they
Mhm.
um, able to go home and relax a little bit, or do they have to go to work, or whatever that stressor might be for your student? But I think for teachers, first and foremost, what can be really important is, again, I keep saying community or I'm gonna preach community, but I think it's important for teachers to lean on each other and having those check-ins. I like to call them little mental health check-ins myself, but I think first and foremost, having even if it's just one person that you are a work colleague with that you can go to when you're just having a really rough day or just a long day and you're worried about a student, just knowing that you have someone to lean on, I think is really important just to decompress before you go home can be important. And then second is also I know this is a buzzword right now, but our two buzzwords is self-care. But part of the check-in that can be helpful is once you do get home, planning out something that you really enjoy doing, whether that be reading, if it's nice outside, going for a walk. Maybe you're going a walk with going on a walk with that teacher friend and or going out and doing something else, that a hobby of yours that you enjoy, and not to add more to teachers' plates, because I know the teachers have so many responsibilities as it is, and I feel like teachers are continually getting more and more placed on them. And so this isn't to add more, but it's really to schedule different times in your daily life, just to have those check-ins and make it pretty regular, so that way it becomes second nature to check in with someone, to lean on your community, and to also have the your own self-care measures in place for when you do have long days. I would say those two things, at least even for me as a mental health provider, is the most realistic. And as someone, I feel as though I can be pretty busy sometimes too. Hearing a bunch of different things doesn't always help because you are busy, right? So making it really what you need it to be, and whether that be self-care for 5 minutes, going out for a walk, or something else that I really like to do is baking. That's a hobby of mine. So I think it's important to schedule that in my schedule too. So for teachers, I think really leaning on your community and creating little tidbits of self-care that can refill your cup up is really important, specifically when you're working with a lot of students that are going to have mental health concerns. And with those statistics, and they're predicting it's going to continue getting worse, teachers are going to be carrying more and more and more of that weight. And so to combat that, as a mental health professional, I think it's important to integrate those two main strategies for people who are very busy.
Well, I don't think there's a better way to end than on those words. And I want to thank everyone for being here and those that are watching the recording. And Aubrey has been gracious enough to give us her email for some follow-up questions, and so much great information for us to think about. And I like your idea of going out for a walk, because my phone is saying it's currently 49 degrees out. So what a better thing to do after our webinar right now is go out for a nice walk. So
Exactly. Yes.
thank you for being here.
Yes. Thank you so much for having me.